Well, I'm Professor Roger Kirby, and I'm here today to talk to you about changing paradigms in the investigation of a raised PSA. This is something that we've produced a comment on in the British Journal of Urology International, BJUI. So changing paradigms in the investigation of PSA is, I think, a very important issue, because up to now, when a patient has arrived with an elevated PSA, the trigger is normally pulled to book a biopsy of the prostate. Now, patients increasingly have heard that biopsies have side effects. They don't like the invasive nature of a biopsy, so you get quite a bit of resistance to that. And I think what's changed recently is the development of 3 Tesla MRI, magnetic resonance imaging, which enables you to perform almost a mammogram of the prostate, the equivalent of a mammogram. So you get the architecture of the prostate, and you get abnormal signals, usually in the peripheral zone, sometimes anteriorly, or in the transition zone. So that tells you a number of things. It tells you where to target the biopsies, and it tells you whether a biopsy is really necessary, because you have to argue that, say you have an elevated PSA, you have a very large prostate that has benign features on MRI, then you might get away with at least deferring the biopsy rather than pressing ahead. And of course, it begs the issue whether you should do a transperineal biopsy, which has a lower complication rate in terms of infection, although admittedly can cause urinary retention, or whether you should do a transrectal biopsy if the target zone, the abnormal area on the MRI, is easily accessible on that modality of biopsy. So I think you have to read the comment in the BJUI to get the full story, but I think we are seeing a paradigm shift in the way that an elevated PSA is being evaluated, or will be evaluated in the future, because I think it shouldn't be raised PSA straight to biopsy. It should be raised PSA 3T MRI with gadolinium enhancement and an experienced radiologist to look at those pictures, and then a targeted biopsy through one or other of the biopsy modalities that we have.